Oh, sorry. Go ahead. Go ahead.
It's longevity week, and this morning we're covering everything from what routine medical tests you should be getting to how often you should be getting them. Here with a longevity testing checklist to keep your health on track this year is Chief Medical Officer and WebMD, Dr. John Whyte. Welcome back.
Hi.
Thanks for having me.
Hi, Dr. John.
So you're having Kelly's having her blood pressure. How often should people have blood pressure?
You know, we really should be checking it a couple times a month. And here's a good tip for you. Definitely check one in the evening because your blood pressure is naturally lower in the evening. So if your blood pressure is high at night, I'm more likely to put you on medication.
To pay attention to that.
Exactly. This idea of getting it checked once a year or once every other year really isn't the way to go anymore.
How's her blood pressure doing?
You know, your blood pressure looks great. It's about 118 over 84.
That's high for me.
Well, this is a stressful job.
Yeah. Right now, I'm like, should I lay down? I don't know.
This is pretty good.
What's another test that people can benefit from?
The other good test is a hemoglobin A1C. That tells you your blood sugar
right?
For about 90 days. But what I've been telling people, they could try something called a continuous glucose monitor.
Is that the thing you stick on your arm?
That's exactly right. I have one on here. It's about the size of a quarter. And this is just an injector. So basically, I would just do this. It would be on. It stays on for 14 days.
Does it hurt?
It doesn't hurt.
Okay.
When you say it does actually inject in your skin?
It actually injects a very small needle, and it tells you your blood sugar over the course of 14 days. And that's going to change behavior. You want to lose weight? You try a continuous glucose monitor.
Okay. What about, we talk about cancer prevention. Talk about the screenings that we should have. What do you recommend?
You definitely need to have screening for colon cancer, which is a colonoscopy or a FIT test, breast cancer, which is a mammogram, cervical cancer, which is typically a pap smear, and prostate cancer. Most cancer can't be screened, so that's why you definitely want to focus on the ones that can and know your risk. So if you have a family history of cancer, someone in the 30s and the 40s in your family, or you did one of those DNA tests that tell you you're at increased risk, or you had radiation, then you need to be screened earlier and more often. That's the trend now.
What about a thyroid test?
Yeah, I'm so glad you mentioned thyroid because 5 times more common in women versus men, 12% of the population. A lot of times doctors order it once and then don't order it ever again. You really need to be getting it every year because as we get older, thyroid disease increases, including thyroid cancer, which is increasing in incidence.
Now, I always say, I think Sarah Silverman said it first and best, death creeps in through the gums.
Yeah.
So what about dental health?
Yeah. You know, I'm not a dentist, but I really appreciate their role because we know there's an association between gum disease and your heart. So you want to be going to the dentist once a year. You want to be brushing and even flossing.
Okay. Are we coming right back? Yes. Okay. Oh, no, we're not coming right back. Oh, this is it. This is the big brush off, Doc.
Yeah.
Jeez. All right. So for more information on all of what we talked about right now, make sure you pick up a copy of Dr. Whyte's book, Take Control of Your Heart Disease Risk, and we'll be right back. Thank you so much.